Wynn. So the next set of questions I'm going to ask you relates to your basic needs. For each question, please answer either yes, no, or you decline to answer. Does that sound okay?
Yes.
All right, great. You're going to see me staring at the computer here a little because I'm going to be clicking your answers. So here we go. It's going to be a set of eight questions. Do you have a doctor, primary care physician, or a nurse that you see regularly?
Yes.
Do you have health insurance or a medical card?
Yes.
Are you worried that your food will run out before you have money to buy more?
Yes.
In the last 12 months, have you run out of food that you bought and you didn't have enough money to get more?
Yes.
In the last 2 months, have you had difficulty paying your electric, gas, or water bill?
Yes.
Do you have a hard time finding transportation to and from your medical appointments?
No.
Do you currently have a place to stay or live?
Yes.
In the next 2 months, will you have a place to stay or live?
Yes.
Okay, thanks for taking the time to answer those questions. We concluded our admission process, and I'm going to make a referral to our care management team. These are a group of individuals made up of nurses and social workers. Is that okay with you?
Yes.
Great. And based on your response related to the food questions, I've made a referral to a company called NowPow. NowPow specializes strictly on food insecurity for our patients. Okay, so they're going to call you either on your cell phone or at home, and going to link you up with some resources related to be able to get food to your house or pretty close to your area. Okay, so if you see a number coming up on your cell phone, if you could answer that for me, all right?
Sounds good.
The second part of that is that you might see a little one of our volunteers come in. She's going to have like a pink smock on, and she's going to have a green bag. This green bag is going to be a bag of food for you. We talk to our patients all the time, right? I'll make sure you have enough medication to go home, supplies to go home, but we don't say to our patients, do you have enough food to go home? And food is medicine. You need to be able to heal, and you need to have the proper nutrition. So we're going to deliver you a bag of food to go home with, okay? And then you'll be linked up with NowPow. How does that sound?
Sounds great. Thank you.
I'll keep an eye out for our care management team that should be coming in, and we'll start talking about what we could do about the utilities that you talked about, having difficulty with that. And we could kind of tackle this together, okay?
Sounds good. Thank
All
you
right,
so
Miss
much.
Wynn, I'll be back. All right, Miss Wynn, the next set of questions I'm going to ask you relates to your basic needs. For each question, please answer either yes, no, or decline to answer. Does that sound okay with you?
No.
Okay, you don't want to answer these questions today?
No, I don't want to talk about it.
Okay, I understand, but I just want to let you know if you decide to change your decision, let me know. I could go in at any time and we could go through these 8 questions. And also, if you decide not to do it on this admission, you will be asked again if you ever get admitted again back to Rush, okay?
Okay, thank you.
All right, thanks.
Hi, Miss Wynn. I'm the volunteer, and I am here to drop off the bag of food for you to go home with. Where would you like me to put it?
You can put it on the chair. Thank you very much.
All right. Have a good day. I'll
You
see
too.
you later.
Thank
Bye.
you.
Okay, hi Miss Wynn, I'm Ray. I'm the nurse care manager. How are you doing?
I'm all right. Thank you.
I'm just coming in, just checking in on you and just with some screening related that was done earlier by your nurse Jen to some of your basic needs. And I can see also too that you got the hospital-based food pantry bag that our volunteer service brought in. So you tested positive on your screening for concerns with paying for your utilities, I can see. And I would like to discuss options with how we can help you.
Perfect. Thank you.
All right, Miss Wynn, so I wanted to go over your discharge paperwork. We call it our after visit summary here at Rush, okay? So we went over your medications. We went over where to get your medications from, your doctor's appointments. Everything's right here, but I also wanted to point out to you this one section here related to NowPow and getting your food, right? Okay, so we have the resources here, the number for you to call, and it's linking you to a couple different pantries around your area, along with the delivery system that we're going to be using for the first 2 weeks to get food delivered to your house, all right? So everything's right here for you, and you let me know if you have any questions, okay?
Okay, thank you so much.
All right.